Welcome to the Pediatric MS Navigating Your Journey program. This program has been uniquely designed for families affected by pediatric MS and features speakers and information tailored specifically for you. My name is Krista Harding, and I am a senior manager on the program and support team at the National MS Society. As we get started today, we want to remind you that the Society's mission is to cure MS while empowering people affected by MS to live their best lives. We also want everyone to feel comfortable coming to the National MS Society for support. For that reason, we share our diversity, equity, and inclusion statement at the top of our program. The National Multiple Sclerosis Society is a movement by and for all people affected by MS. Our voices and actions reflect diversity, equity, and inclusion. We welcome and value diverse perspectives. We actively seek out and embrace differences. We want everyone to feel respected and be empowered to bring their whole selves to ensure we make the best decisions to achieve our mission. For those of you that might be new to the world of pediatric MS, let's start with a general overview. Before you or your child were diagnosed with MS, you may not have known anyone with MS, or you may not have even heard of it before. We learned from a study published in 2019 that nearly 1 million people live with MS in the United States, and there are 2.8 million people worldwide living with it. It is estimated that fewer than 5,000 children and teens live with MS in the US, and fewer than 10,000 teens live with MS worldwide. So, what exactly is MS? MS is a disease of the nervous system, which includes your brain, the spinal cord on your back, and your optic nerves, which connect your eyes to your brain. In MS, the body accidentally attacks normal cells called myelin, and when that is damaged, it is difficult for nerve cells to send and receive information to and from the brain. One way to imagine this is to think about when a phone charging cord is damaged. If the outside coating isn't doing its job, the wires underneath might not work as they should, and charging may even become much slower. So, like the charging cord, damage to myelin may slow down the messages your brain is sending to the rest of your body. These attacks produce something called lesions, which can cause symptoms in MS. We don't yet know what causes MS, but researchers are working hard to figure it out. We know that you don't get MS directly from your parents, and that some of your DNA, called genes, may make you more likely to get MS. We do know that women are 3 times more likely to have MS than men. We also know that MS is more common the further away you get from the equator. We know that having low vitamin D levels, being overweight as a kid, smoking or living with someone who smokes, or having been sick with mono could make you more likely to have MS. However, it is more important to know there is nothing that you or your parents did that caused you to get MS. In fact, scientists believe that getting MS is caused by a combination of factors, and many of them are completely out of your control. We don't yet know what causes MS, but researchers are working hard to figure it out. What we do know is that you can live a long and happy life. There are 4 types of MS, but for young people, relapsing remitting MS is most common. People with relapsing remitting MS often feel fine, but then have periods where their symptoms last more than a day and feel much stronger. Those periods are called relapses, but some people call them exacerbations, attacks, or flare-ups. All these words mean the same thing, a time when your MS makes you feel worse. Even though relapses last longer than a day, you will feel better once they end. Most young people recover well from relapses, and relapses don't necessarily cause permanent damage. There's nothing you did wrong that made you have a relapse, and some medicines can help you manage them. MS can make your body feel strange, and everyone's experience with MS is different. Sometimes your vision might become blurry, your hands might tingle, or your foot feels numb for a while. Some of you might feel really tired every day or like you can't focus at school, and others might feel sad or worry or be in a bad mood a lot. Maybe you feel a couple of these together, and maybe there are symptoms that come and go. All of this is normal with MS. There are things you can do to help your body feel good, like eating nutritious foods and being active. And even though we don't yet have a cure for MS, there are medicines you can take to help, both for your body and for your mind. Your doctor might also prescribe a disease-modifying therapy to treat your MS. The goal of these medications is to prevent MS from getting worse by preventing new damage, those lesions we talked about earlier, from being formed. The medicine might not make someone feel better, and because of that, they might not want to take it sometimes. But it is constantly working inside their body to help stop them from having new changes or relapses in the future. They may not even notice that it's doing its job, but it is. MS medicine will work best when someone starts taking it as soon as they find out they have MS and continues to take it regularly as prescribed by their doctor. Because everyone's MS is different, medicines work differently for each person too. So your doctors might want to try out a few different kinds right away or in the future. No matter which one you choose, the best medicine for you is the one that you, your parents, and your doctors decide is the right fit to help you feel as good as possible. And for any of the kids on this call, I want to make sure you know that the way you feel about your MS treatment matters. I want all of you to know that you should be sharing with your doctors what you feel and what your experience with your medications. Your opinions matter, and I would encourage you to be an active part of your own care team. Now, let's meet our presenters for today's program. Please join me in welcoming Dr. Lana Harder and Dr. Natalie Escalante. Dr. Harder leads the Neuropsychology Service and Neuropsychology Training Program at Children's Medical Center in Dallas. She holds dual faculty appointments as Professor of Psychiatry and Neurology at UT Southwestern. Dr. Harder is board certified in clinical neuropsychology and is a board certified subspecialist in pediatric neuropsychology. Dr. Harder earned her doctorate from the University of Texas at Austin and completed her pre-doctoral internship at the Kennedy Krieger Institute and Johns Hopkins School of Medicine. She completed postdoctoral fellowship at Texas Children's Hospital and Baylor College of Medicine. Dr. Harder has served as a pediatric neuropsychologist at Children's Medical Center since 2008. She was a founding member and is the current co-director of the Children's Medical Center Pediatric Demyelinating Diseases Clinic. Dr. Natalie Escalante earned her PsyD in clinical psychology at the Chicago School of Professional Psychology, Anaheim. She also obtained her MA in clinical psychology at the Chicago School and a BS in psychology from Texas A&M University. She completed her internship training in clinical psychology through the APA accredited program at Miracare Neurobehavioral Health Center in Palos Heights, Illinois. She completed a one-year psychology fellowship at Children's Medical Center. She has continued on to complete a 2-year postdoctoral fellowship in pediatric neuropsychology.
Thank you for that introduction. As she said, I'm Dr. Harder. I'm really happy to be a part of this and communicating with you today. I wanted to start by setting the stage to tell you a little bit about the work Dr. Escalante and I do in neuropsychology. So neuropsychology is the science of human behavior as it relates to central nervous system function. So think about, how we think, process information, remember things, pay attention. So all of those cognitive skills, we focus on that, as well as behavior, emotional functioning, and we're really interested in quality of life. And related to MS, fatigue is a part of that, a part of what we look at. Next slide, please. The role of neuropsychology when it comes to clinical care, what we're known for best, I would say, are these comprehensive neuropsychological evaluations where we assess those areas I showed you on the slide before. We also are available for consultation or to do a briefer, more focused screening evaluation. We also participate in transition planning for those teens who are transitioning to adulthood to help prepare for that life stage. Other things we do involve research so we can learn more about multiple sclerosis, and then education and clinical training, as well as leadership. Next slide, please. So that gives you a sense of what we do in neuropsychology, which we wanted to mention before introducing our topic today. So we want to talk today about the mind-body connection in pediatric MS and explore that relationship between mental health, fatigue, and daily living. Next slide. So in terms of common symptoms of MS, wanted to set the stage here for this as well for our discussion today. Next slide, please. So in terms of those cognitive skills, which I shared previously, things like memory, attention, how quickly you process information, we know for adults with MS, about 1/2 struggle with cognition, with cognitive problems. But for our patients who are diagnosed before 18, so our pediatric patients, it's only about 1/3 who have those cognitive problems. Next slide. Another piece we really focus on is mood. And so depression is one of the symptoms that is actually pretty high in terms of the prevalence or the rate someone might experience it across their lifetime. So about 1/2 of people diagnosed with MS may experience depression across their lives. There is an important and I think interesting factor to consider that MS, the role of inflammation, which is part of the MS process, is actually serving as a underlying cause or mechanism related to depression. And so research has shown that it's, more than maybe responding to kind of having feelings about having MS or some other reason, but the actual condition can be a contributing factor. For our individuals who had MS started in the pediatric years before 18, about 1/2 of those meet criteria for a psychiatric diagnosis. And these do tend to be more internalizing, such as depression, anxiety, things of that nature. So this is something we really have on our radar in neuropsychology when we are working with individuals with MS. Next slide, please. Another piece I had mentioned in the very beginning is fatigue. This is a really important symptom to highlight, I think, when we consider the overall functioning of a person who has MS. This one is often called out as the most debilitating symptom of MS. It really gets in the way of daily life, can impact quality of life. A significant number of our pediatric patients tell us that fatigue is a problem for them. And it is one of the most commonly reported symptoms in MS overall, with 75% of adults with MS reporting fatigue. So I think it's important to acknowledge the overlap of symptoms. So we've just described difficulties that may show up with thinking skills, the symptom of fatigue, maybe some mood-related changes like depression, and then just thinking about overall health-related quality of life and how we experience life each day. One thing I talk to patients a lot about is I ask them, because it differs from person to person, is how does MS show up for you in your daily lives? And so that's a conversation that we have when our patients come to clinic. A benefit, I think, of coming to neuropsychology or working with, your medical team is to really start to identify or separate some of these symptoms out. The reason that's important is because when we do that, when we can identify maybe that primary symptom or two that's causing difficulty, then we know how to address it. We know what the treatment or the intervention might look like. So next slide. A common one that comes up, a common question, this comes from the kids that I work with, their parents. It also comes from the medical team who are working with the same patients, is this question of how can you tell the difference between depression or fatigue? So I really want to talk about that because there is an overlap. And what you see here is that these symptoms listed, changes in sleep, maybe slowing down in motor coordination, loss of energy, diminished engagement in activities, diminished cognitive skills, those are all things we can see as kind of overlapping symptoms. Next slide, please. But as we separate these out, we can really start to try to understand for an individual that comes to see us, what might be, primarily a fatigue presentation. So that's feeling tired. This leads to reduced engagement in activities or feeling, maybe physically weak. For something that's more mood-based around depression, This would be depressed mood, feelings of sadness, emptiness, hopelessness, maybe changes in weight, motor agitation, feelings of worthlessness or guilt, and even recurrent thoughts of death and dying. So we really try to understand what might be going on. And to be clear, it can be both, right? Someone could have all of these symptoms or have complete overlap of, there is depression here and there is fatigue here. Someone at a recent educational event gave a great example. And she said, imagine that you were invited to go do your favorite thing. And so I'll give this example because we're in Dallas. And so maybe someone calls and says, do you want to come to the Dallas Cowboys game, this Sunday? And so if that's my favorite thing to do, and I love the Dallas Cowboys, then, I'm testing my reaction to that to try to understand this. So I might think, oh gosh, that sounds really fun, but that would be very exhausting. We have to park and walk a long way, and then the game lasts several hours. I'm not sure that I could really last the whole time, right? Versus if someone is experiencing more of a depression presentation, that might sound more like, well, I don't even care who the Dallas Cowboys are playing or if they win or not, right? So that was this person's kind of test to check in with yourself. Imagine that you're invited to do your favorite thing. What might be your reaction to that based on how you're feeling? So I really liked that example, and I thought it gave kind of a practical suggestion for kind of doing a quick self-assessment, a quick self-check-in. Next slide. So one of the biggest takeaways that I want to share in this presentation is that research has shown us that not only are these symptoms kind of interrelated and overlapping at times, but when we treat one problem, we can identify or prioritize one problem, maybe a couple of problems. If we treat one thing, we may also be treating another or other problems. So I think that's a really important thing. It can feel really overwhelming if there are multiple symptoms or difficulties involved, but if you can figure out what is causing maybe the most distress and pick that thing to treat, to intervene on, to try some things to address it, you may also see improvements in these other areas. So really want to emphasize that point. So just to kind of summarize, MS may be associated with lots of things, and we've talked about like thinking, energy levels, mood, quality of life. But it's really, really important to also emphasize that not all people are impacted the same way. So there's not a one-size-fits-all approach to intervention. Again, going back to assessment, working with a neuropsychologist and our medical teams, we can really get a nice, clear picture of what it is that we're struggling with to then inform those interventions. But these have to be tailored to the person, right? And I said earlier, if you think about what's the most distressing, what's interfering the most with daily life, when I asked the question before is, how does MS show up in your life each day? When you think about that and then think about what is interfering the most or distressing you the most, that is usually a clue that that's a good place to start, a good place to set a priority. Next slide. I'll turn this over to Dr. Escalante now.
Thank you, Dr. Harder. So Dr. Harder has been talking about kind of mental health, and I think there might be some misconceptions about what mental health is. So I would like to kind of talk about it. So yeah, what is mental health? So mental health is kind of a general state of psychological well-being. It's how we cope and manage stress, how we relate to others, and how we make choices. It can be a part of how we think and how we feel and how we act. So if we are in a better state of mental health, we might respond differently than when we're probably not having a good day. It is a part of being human, and it's a part of every stage of life everyone experiences throughout their lifetime. And as much as we take care of our physical health, mental health needs to be taken care of as well. The brain and body are connected, and how you're feeling can definitely play a role in your physical symptoms. So one thing that's really important is we want to shout out to all of the feelings. I think sometimes there's negative connotations to more unpleasant feelings like sadness or anger or grief. And so I think it's really important to acknowledge that all of those feelings are there for a reason. They provide something that we might need. And so all of those feelings are a very valid experience to have. So you might be feeling sadness, but maybe if you dig deeper and kind of think about that, you might actually be feeling grief. Or you might be feeling anger, but really it's fear. And so, what you want to kind of sit with yourself is really, and this can be done with a person that you care about, or even someone like a mental health therapist, could be identifying like, what is the root feeling and why do I feel this way? And instead of kind of pushing it away or maybe not wanting to feel it, you want to think about, okay, how can I experience this feeling and allow it to pass through you? Like a train would kind of go through a station. We don't want to roadblock the train. We want to allow ourselves to feel that emotion and it will pass. That's the cool thing about feelings. So next slide. So I think this is a great kind of illustration about how sometimes our lives can get hectic and can feel overwhelming. And so things can kind of build up. One example that I like to give is if you're having a bad day, and right as you're getting home, you drop your keys on the floor before you're able to kind of get into your house or your apartment, and it kind of feels like the world is crashing down. That experience itself is not the reason why you felt bad, but when we have kind of things that happen every single day, it can kind of feel like our emotions are spilling over. And so I think this is a great illustration because we want to be able to identify when we're about to spill over so that we can engage in self-care activities to make sure that that doesn't happen. Okay, so I love this illustration because just like any muscle that you work out, your brain is a muscle. And so these are activities that self-care activities that you have to kind of do over and over again. So if you just go to the gym one time, you're not going to change. You're not going to build strong muscles. It takes this repetitive every single day or multiple times a week in order to kind of build that strength and build that muscle. So just like our physical muscles, we want to think of our brain as a muscle. And so we want to engage in these activities, these self-care activities regularly and frequently. And so that can look like journaling every single day, or that can look like taking a walk and getting some fresh air every day. And one thing that is really important too is sleep. Sleep is super important. And if we are not sleeping consistently, 7 to 8, even 9 hours a night, and we only do that once a week, we might not feel our best. And so those are some kind of things that we have to do kind of over and over again. These are some great ideas for promoting that mental health and those self-care. So sometimes we don't have the time. I know our teens are busy. They have school. They might be feeling that fatigue, or they have extracurricular activities or social things that they want to do. So these are just little activities that you can do in order to make yourself feel a little bit better. So just going outside if it's nice out, or even if it's not so nice out, getting some fresh air is still great. Breathing, working out, listening to music, hanging out with a pet. I know that being with my dogs makes me feel very happy. And just kind of tuning into what works for you. Some of these things might not work for you, so don't do it. Find another thing. And I think that's really important to, again, work with either your parents or a trusted friend, a family member, or a mental health therapist. So there are also things that can be done in the school to help promote some of this mental health that we're talking about. And a neuropsychological evaluation can provide some additional examples and can help with getting formal educational supports in place, like a 504, an IEP plan. But there are also some other things that you can just talk to your school and your teachers and see if any of these things can be implemented. So that might be sitting near the front of the classroom so that you don't get distracted by others, or getting some extra time and talking to your teachers of, I haven't had a great week and I need, an extension on this assignment. And of course, some of those are more formal educational support. So having something like an IEP or 504 plan might be needed. But some of these things you can definitely talk to your teachers about. So wellness is not just one thing. It's a combination of all of these things. It's talking to someone, it's feeling supported, it's sleeping well, exercise, making sure that we're interacting with our peers and our family members and doing things that make us feel good. And identifying those things is one of the most important steps. So mental health is health. It's not something that's separate. It's not something that should be neglected. I really want to, encourage you to utilize the people around you to help get through some of the challenges that we might experience as just people. And then, of course, individuals with MS who might be experiencing what you are experiencing. So, just being here, just watching this video is great, and being a part of community organizations can make us feel supported and can definitely be stronger together.
Yes, and I agree with and love that point that Dr. Escalante just made. I think the National MS Society does an amazing job at connecting communities and having programs like this one. So, and another thing that we wanted to touch on when we think about overlapping factors that go with MS, we never want to forget about the life stage of the person that is affected by MS. So being a teen just by itself, if we took MS out of the picture, comes with, a whole host of things. And so we really want to be mindful of that and just be aware, I think, as clinicians when working with patients, this question comes up a lot. So we just always want to make room for a developmental stage and all of the things that come with that.
So living as a teen with MS can come with lots of different things, some that are completely normal for any teen, but also some things that are kind of specific to being a teen with MS. So there might be this expectation for independence, right? You are learning to drive and figuring out how to go places with friends and do things independently. But that might be a little bit more challenging if you have different things that impact your ability to do those independently. And so there might be this balance of identifying areas where you can be independent and then identifying those areas that you might need extra support. So this is really important to have those conversations with your parents or your teachers. Maybe you're able to independently drive to school with a parent. And then, in other situations, you might need your parent to drive you other places. So identifying different areas where you can be independent, and parents, I think it's really important for you to know those places too. If you know your child might need a little extra support, but might not be willing to ask for it, be there to lend a helping hand, but also to promote that independence. One thing that comes up often is, how do I talk about MS to my friends or to my teachers? And like anything, it's a very personal choice. Some people might be comfortable with openly talking about MS and what it means for them, and some people might not be. So I think it is again, important to have those conversations with your medical providers about what MS is, to make sure you have a good understanding of it. And then knowing that you don't have to share it with everyone. You don't have to, if you don't feel comfortable with that person or you don't feel like it's necessary, you don't have to. And just identifying whatever areas are important to you. So if it's important that your teacher knows that you might be struggling with some cognitive fatigue, then that might be someone that you can chat with. Doesn't have to be in the classroom. It can be in an outside time. You can schedule a time to talk with them. But we find that people are receptive to understanding what someone is going through, but it's not something that you need to scream to the world.
And along those lines, thinking about sharing with school, sometimes we're in a position where we want to get some good documentation in place to be able to get services. And I'm thinking, especially as we transition from high school, maybe in that kind of college or higher education setting, just remembering that when you share information that is for the purposes of getting, say, special education or those 504 accommodations or something along those lines, those records are also protected, similar to your health records. So, but it is a, as Dr. Escalante said, still a personal decision of if you kind of open that door, share that information to begin with. Sometimes there can be a benefit to that if it's helping you get the services you need. And then sometimes there are ways to get those services maybe without all of those details, depending on the specific situation. So I had to acknowledge that. And then one conversation that I was thinking about with Dr. Escalante as we were putting all of this together is, I think especially when a diagnosis is new, but maybe even if it's been a while, if it's been months or years, it can just be this really overwhelming experience, is what I've heard our teens describe, and kind of feels like there's, it's all you can see, it's all you can think about as far as the future is concerned. And so maybe there were goals, plans that, are kind of falling by the wayside because now MS is here and I have to figure out how to navigate that and manage that. And so one thing that we do as kind of an exercise and just a kind of a challenge that we give is to think about what your goals were, what they are, kind of, again, with or without MS. Let's think about those goals. And, maybe there needs to be some adaptation and maybe not. So we just want for our teens to just consider those goals overall and kind of work to keep a focus on that while still acknowledging MS, certainly still going to appointments, taking prescribed treatments, all of the things we do to take care of ourselves when having MS. But this is also, allowing for a focus on the future and those future goals.
So even though it might feel like you are kind of clouded by MS, there are routes and there are ways to continue to achieve the goals that you have. And, we, as your medical team and as neuropsychology, we want to help find ways to get you there. And so using your community engagements and using your medical team to kind of help identify those paths is definitely encouraged. And there are ways to kind of continue to do what you wanted to do. And sometimes it might be helpful to think, okay, if I didn't have MS, how would I get there? And then we can kind of add back the challenges or obstacles that you might encounter. That way we can find ways to kind of hurdle those and still get to where you want to go. So I think there is some notion of life is just one path. You just stay on one path. You go to beginning to end. But as you might know, and as you teens will experience, life isn't actually just the straight path. There are things that happen to us, things that we choose to do that will take us in all types of directions. And it kind of more so looks like this. And so really, we want to lean into that, lean into the different places that life will take us and the different ways that we might go. And it might feel like, I'm actually going down. but that might take you right back up. And so one thing that we want to highlight is that it is important to know that you can reset, refocus, and restart at any point. You don't have to start on Monday. You don't have to start tomorrow, but you can take every moment to change the way that you're thinking, to change the things that you're doing, or to start over. And so I think it's a really powerful thing, and it's something that I try to encourage myself to do whenever I'm having a bad day. Instead of just continuing to have the bad day, I might identify one area that would make me feel better. And that can kind of change the trajectory of the rest of my day and my week. And so finding those moments and choosing to when you can, when you have the ability to focus on what you can do to make yourself feel better in just moments to moments. Make time for mental health each day. Like I said, there's all of those different activities that you can do to just make those little moments count. Mental health is a part of your physical health. And I know that those things might feel separately, but they are very interconnected. So, actively choosing to work on your mental health and making those decisions. One thing that I always like to say is you don't always control your thoughts, you don't always control your feelings, but you are in control of your behavior and what you choose to do every single day. And so that can be, just listening to a great song that makes you feel happy. So what does pizza have to do with mental health? We'll do a little activity here. Sometimes when we're feeling overwhelmed, it can be good to just take a deep breath. And I know people say that all the time, and what does it mean and how does it help? But we know that physically slowing your breath down can really help with feeling more rested, and it really relaxes that nervous system. And so we want to just kind of do an activity to talk through what you might think of whenever you are feeling overwhelmed and how to kind of use this in a real a daily stressor. So this is called pizza breathing. And so we'll kind of go with the video. So we want you to think that there is a pizza here, and you are going to smell the pizza and then cool it off. So let's smell it. Yep. And cooling it off. We're smelling the pizza and cooling it off. And smelling the pizza and cooling it off. So this is an activity that you can do in your daily life to during those moments when we're feeling overwhelmed, when we're feeling like we just can't go anymore. We definitely want to take in some breath and breathe it out, and do it as many times as you need until you feel better. I think it will make you feel better.
And I think there's research to show that it calms down your heart rate and things. So that's awesome. And then going to this next slide here, I just as we wrap up our part of this presentation, really want to provide you all with some information on how to find a neuropsychologist, a psychologist, or a therapist. So if anything that we've talked about today, these some of these common symptoms of MS, if you identified with that or have had some experiences, it may be helpful to work with a neuropsychologist who could do that in-depth assessment and really look at all of those pieces of the puzzle. And with the ultimate goal of helping you with a tailored plan, a tailored list of recommendations that are really made just for you. Neuropsychologists also work with people over time. So they might see someone every year, every other year, or at major transition points in life if someone's starting high school or, going to university. So There's different ways to work with a neuropsychologist, both in the short term and then across time. Our colleagues who are psychologists and therapists also do really wonderful interventions to address, we talked about mood, depression, and all kinds of things. And they're great partners in your overall care plan and thinking about your overall team that you have. So places to find these folks, the American Board of Professional Psychology actually has lists of psychologists and neuropsychologists who are board certified, and they have that by region, so it's easy to find folks in your area. Similarly, Psychology Today has lists of psychologists, neuropsychologists, therapists, and then checking with the referring provider. Often they have a list. If they make a recommendation, often they'll have some ideas of where to go and would maybe know folks in your area. Other folks that you're working with, if there's a social worker on the team, they're a great person to ask. And then, of course, importantly, checking with your insurance carrier to determine if the service is covered is really important. So those are just some ideas for finding providers.
Great. Thank you so much, Dr. Harder and Dr. Escalante. That was a really fantastic overview of mental health and fatigue and all sorts of great tips and tricks that we can be utilizing to best care for ourselves. I really appreciate your time today.